Welcome dear learners. Today we will discuss about cholera. Cholera is a bacterial disease caused by Vibrio cholera. It is an acute diarrheal illness. The infection is caused to the intestine by a bacteria Vibrio cholerae. Epidemiology. Cholera was prevalent in the 1800s, but due to proper treatment of sewage and drinking water, it has become rare in developed countries nowadays. Cholera is a fecal disease, meaning that is it spread when the feces of an infected person comes in contact with the food and water bodies. The incidence is around 1 in 1 lakh worldwide. Over 1 million cases and nearly 10,000 fatalities are recorded per year. The incubation period, it ranges from few hours to 5 days. Universally, it has been found that the incubation period is of around 5 days. Shorter incubation can be seen in case with high gastric pH and in consumption of high doses of cholera. Now, periods of communicability. During acute stage, a few days after recovery, by the end of a week, 70% of patients are non-infectious, and by the end of third week, almost 98% of them are non-infectious. Host factors, age, it can be a children. Children's they are 10 times more susceptible than that of adults. Even the elderly peoples are at an higher susceptibility risk. Sex, it is seen equal in both male and female. Immunity, less immune, they are at an higher risk. Next, people with low gastric acids, they are susceptible. And if we compare the blood groups, O blood group containing people are at an higher risk than that of B, which are lesser than or which are greater than that of A and AB. Now the causative agent, Vibrio cholerae. Vibrio cholerae is a gram-negative bacteria, a type of gamma proteobacteria. It has distinguishing features like it has oxidase positive. It is a motile because of having a flagella, polar flagellum, and it is both respiratory and fermentative metabolism. So because of that, it is prevalent. It can be seen in most of the water bodies. Gamma proteobacteria, they get their names from, that is they can change their shape. So this Vibrio cholera also, it can change its shape from rods to curve to Vibrio comma shaped structures. Pathophysiology of cholera. Vibrio cholera, it accumulates in stomach. If a person it consumes the infected water, it accumulates into the stomach, which produces a toxin. That toxin then binds to the G protein coupled receptors, which inactivates the GTPase, an enzyme required for the conversion. Thus, the G protein stuck in on position, which in turn increases the cyclic AMP concentration, which activates an ion channel, and there is an influx of NaCl into the intestinal lumen to drag water into the lumen, and this leads to watery diarrhea. Here we can see this cholera toxin, Vibrio cholera, which produces a toxin which goes and binds on GM1 ganglioside receptors, which releases the A subunit. This A subunit it binds with the G protein coupled receptor, which in turns blocks the adenylate cyclase. Thus, the concentration of cyclic AMP is increased, which leads to the efflux of chlorine, sodium, and water ion. So, thus it leads to diarrhea. What are the common signs and symptoms of cholera infection? Most people they remain asymptomatic. The symptoms of cholera may include the profuse watery body, stomach pains, leg cramps, mild fever, nausea, vomiting, sunken eyes and cheeks, dry mucous membrane, and of course diarrhea and decreased urinary output. The primary symptoms of cholera are profuse, that is, a painless diarrhea and vomiting of clear fluid is seen. The diarrhea is frequently described as an rice water, which may have a fishy odor. An untreated patient, a person with cholera, may produce 10 to 20 liters of diarrhea a day, which can be fatal for him. The patient's skin, it's turning bluish gray due to excess loss of the fluid. If the severe diarrhea is not treated, an intravenous rehydration, it can result in life-threatening dehydration and electrolyte imbalance. The typical symptoms of dehydration includes low blood pressure, poor skin texture, that is wrinkled hands can be seen, sunken eyes and rapid pulse. Further complication, it can lead to severe dehydration. It can even lead to shock. It can lead to even renal failure, which ultimately leads to the death of the person. What are the risk factors for this? So, poor sanitary conditions are the major factor, which is rarely seen in developed and even developing countries, but commonly seen in countries like Asia, Africa's, Latin America's. Next is the raw or undercooked food. Contaminated seafood is the major source of this infection. Even this is seen in developed countries. Many people they eat the raw food, the seafood through which this infection is caught. Especially the shellfish. The shellfish it is a common source of this infection. Next is hypochlorohydria. People with low level of stomach acid they are also at a risk, such as children's, old adults, and some medications. Even the type O blood group peoples they are at a higher risk. Reason aren't clear. The causes or the mode of transmission. So drinking a contaminated water is the major reason for the transmission of disease. And next is the eating up of raw or undercooked shellfish. Diagnosis. The clinical diagnosis. Cholera should be considered in all cases with severe watery diarrhea and vomiting, traveling to affected areas and eating shellfish. No such distinguishing clinical manifestations for cholera are known as of now. The differential diagnosis, the enterotoxigenic E. coli, the bacterial food poisoning, and viral gastroenteritis are the common differential diagnosis. What are the laboratory diagnosis? Culturing it on a plate. Vibrios often detected by dark field or phase contrast microscopy of the stool. These organisms are motile, appearing like shooting stars, that is, they are moving stars like organisms. The microscopy it shows the sheets of curved gram negative rods when placed on source dishes. On sucrose dishes, it shows yellow color colonies appearing the cholera are present on that media. The other laboratory diagnoses are the PCR can be used for the diagnosis. Even monoclonal antibody based tools tests are available now. What are the treatments? Continued eating speeds the recovery of normal intestinal fluid. So it is advised to have a sufficient food. The World Health Organization it recommends this generally for the cause of diarrhea, no matter what the underlying cause may be. CDC training manual specifically for cholera it states continue to breastfeed your baby if the baby has watery diarrhea. Even when traveling to get a treatment, adults and older children should continue to eat frequently. The other treatment includes fluids. In most of the cases, cholera can be successfully treated with oral rehydration therapy. We call it as an ORT, which is highly effective, safe, and simple to administer. Electrolytes, as they frequently in is initially acidosis, the potassium level may be found even though large losses have occurred. The antibiotic treatments for 1 to 3 days shortens the course of the disease and reduces the severity of the symptoms. Doxycycline is typically used as a frontline antibiotic. The other antibiotics which may have shown proven to be effective includes quatrimoxazole, erythromycin, tetracycline, chloramphenicol, and flurazolidone. What are the prevention measures? So the basic health education and hygiene it can lead to prevent from causing of this disease. Next is mass chemoprophylaxis, provision of safe water and sanitization, comprehensive multidisciplinary approach which includes water, sanitization, education and communications. Vaccines, the parenteral vaccines, 2 doses are administered 2 weeks apart. Its efficiency is approximately 50% and hardly exceeds 6 months, which is not recommended nowadays. Killed vaccines, the killed whole cell or Vibrio cholera in combination with recombinant B subunits of cholera toxin. This is generally recommended. Safe in pregnancy and breastfeeding. Its efficiency is approximately 50% after 3 years. Only mild side effects are seen. The other type of vaccines includes live attenuated CVD 103 HGR vaccines. The protection is as early as 1 week after vaccination. That is, it's a fast and its efficiency is also more than 90%. The unknown efficacy of for the children under 2 age is seen. No adverse side effects are noted in this case. For controlling the diarrhea, the treatment centers are set up. Treatment center for the prompt treatment, sanitary measures, food safety and animal health measures should be maintained. Comprehensive survival data that is adapt to each situation for a comprehensive multidisciplinary approaches. Thank you.